initiation of blood flow restriction training occurred in 1966 in Japan by Yoshiaki Sato, and he developed this particular line that is called Katsu training. Katsu in Japanese stands for additional pressure, and that is how we go about restricting blood flow. One of the things that I tend to do in my presentations is I like to give you the answer that's at the back of the book first. And so the summary statement is that by impeding venous flow out of an extremity and then asking the muscle distal to the band to perform easy exercise, a profound disturbance of homeostasis is created in the working muscle due to the mismatch between blood flow that the muscle needs and blood flow that the muscle can get. This disturbance of homeostasis upregulates protein synthesis locally and is communicated to the CNS or the brain, which in turn releases a systemic autonomic and hormonal anabolic response that goes throughout the body and facilitates protein synthesis. Since there is little actual damage done by the low absolute loads, improved strength and fitness occurs rapidly. Another way of saying this, and here's the proposed mechanism, is that we restrict, impede, or alter venous flow out of the extremity. And by doing so, the exercising muscle does not get the blood flow it needs to maintain homeostasis in a timely manner. This disturbance of homeostasis ensues, which causes an upregulation of cell surface receptors, upregulation of protein synthesis, and in addition is communicated to the CNS. The CNS or brain reflexly alters autonomic function by increasing sympathetic tone, and also stimulates and releases growth hormones out of the hypothalamic pituitary axis. These hormones then go throughout the body. And because minimal tissue damage is done by the easy exercise, and you get a maximal anabolic response out of this hormonal release and local factors that are changing, the balance between breakdown and buildup of tissue is tilted in the favor of building up. And so the ultimate result is an increase in strength and fitness. Now, one thing that I think is very important to distinguish, and we want to do this up front, is that not all blood flow restriction training is the same. There have evolved two main ways of doing this. One is a wide, inelastic cuff that is designed to cut off blood flow. And you can see an example of that on the left-hand side of the screen. And that is a very different kettle of fish than the narrow elastic bands that both Katsu and BStrong are, which are designed to impede blood flow. The things that were used for the wide cuffs originated as surgical tourniquets, which did a very good job of cutting off blood flow. But occluding blood flow is a danger and a risk for all forms of blood flow restriction training. The BStrong and Katsu systems are designed not to do that. One of the things that happens at first when we put on a narrow band is that the surface veins are occluded and distended, and this redirects blood trying to get out of the extremity into the deeper veins. Here is a chart or a table that describes some of the differences between the wide versus narrow bands. And the first order of business is comfort of having the cuff or band in place. With the wide cuffs, when they are set to pressure, they can be very uncomfortable, and clients often complain about the level of pain that are associated with them. With the narrower elastic bands, there is either no discomfort or very mild discomfort from the local site. Another big difference between these two kinds of bands is the pressure that is required and in these cuffs or bands to do things. For the wide cuffs, usually systems go to 50 to 80% of the systolic blood pressure. Systolic is the high point of a blood pressure measurement. For example, if your blood pressure is 120/80, it's the systolic is the 120. So, and in these cases, knowing the systolic blood pressure is important to be able to calculate the percentage of that blood pressure that you want the cuff to go to. In the case of the narrow bands, we end up using multiples of the systolic blood pressure. For example, anywhere from 100 to 500 millimeters of mercury, and exactly what the systolic blood pressure or the blood pressure is irrelevant. For the category of safety risk, almost all serious complications associated with blood flow restriction training are due to arterial occlusion. And with the wide cuffs, they actually, that's what they're designed to do, and they go to an occlusive pressure in every session and then back off onto a percentage of that. The risk of muscle damage is profound. There are no safety studies published in the literature on what happens with repeated use of these things. So there's a potential for risk of arterial occlusion that leads to complications. With the narrow elastic bands, we have shown that there is a very low to almost zero risk of arterial occlusion with the way that we do these things. And if there is a very minimal risk of occlusion, there is also very minimal risk of any serious complications associated with it. From an efficacy standpoint, with the wide cuffs, I should say with the efficacy, virtually all the studies that are in the literature have been done with narrow elastic bands, and almost, I would say, the vast majority of those have been done with the KATSU system. And these are the studies that have been peer-reviewed and published in peer-reviewed journals. And they show over and over again a dramatic increase in strength and fitness associated with the proper use of these narrow elastic bands. With the wide non-elastic cuffs, there are very few studies in the literature, and they do not address the issue of efficacy. Now, at the same time, there's lots of anecdotal studies about how both systems end up producing significant improvements in strength and hypertrophy. But with respect to peer-reviewed published studies, really only the very narrow and elastic cuffs have been shown to be effective. The other issue with the wide non-elastic cuffs that need to monitor blood pressure throughout the thing to avoid the possibility of occlusion. These systems need to be tethered to the equipment, and that then confines the person to being in a short radius of wherever these tubes allow. Normally they're in a training room or near some exam table. So in this way, they're often difficult to use and to use for specific motor patterns that you'd like either rehabilitating athletes to utilize or to be used out on the field or in the weight room for training purposes. In contrast, the narrow and elastic BFR bands are useful in all environments, whether that's in the water, outdoors, indoors, winter, summer, whatever, because once you have these things adjusted to the appropriate pressures, you're free to do pretty much any sport-specific movement. So in this slide, we're asking again if blood flow restriction training is safe. And the answer is an emphatic yes when safety guidelines are followed, and particularly when using the narrow elastic cuffs. All major complications occur as a result of occluding the circulation, both arterial and venous. And if you don't occlude the arterial inflow, you are eminently safe. By the way, there are no contraindications to the use of narrow elastic band BFR other than acute medical emergencies, where in that case they ought to be going to the emergency room anyway. We don't recommend that pregnant women start a BFR pregnant until after they deliver out of an abundance of caution. But those already doing BFR and become pregnant can continue as long as the exercise is comfortable. There is a rare situation with women who are post-axillary dissection, meaning removing the lymph nodes from an arm or radiation of those lymph nodes due to breast cancer, or to someone who is in renal failure and on hemodialysis. We don't want to do blood flow restriction training on that extremity. However, the other three extremities can be used for effective sessions. Generally, when utilizing blood flow restriction training post-operatively, we wait 72 hours before we start the training, but otherwise we don't want to put bands across fresh wounds. For example, in a case of hip replacement operation, we wouldn't put the bands across the healing incision for 4 to 6 weeks. In contrast to the wide cuffs, there has been published research on the safety of, in this particular case, KATSU bands. And in 2005, there was a survey of various people using KATSU bands in Japan. We can spend a little time and attention looking at that. So in that survey, where they had responses from 12,642 people, there were 6 cases of deep venous thrombosis in those people during the time that they were doing KATSU sessions. I should say around the time they were doing KATSU sessions. These 12,642 people had done more than 32,000 sessions. One of the things to say is that works out to an incidence of about 1 in 2,000 DVTs in the national survey. In the general population in Japan, DVTs occur at a rate of about 1 in 100,000, and in hospitalized populations, about 1 in 100. And if you look at the graph over the pie chart over on the right-hand side, you see that at least 22% of these respondents were located in hospitals and clinics at the time. Many others were in doctors' offices or rehabilitation centers, where you might expect to have a 1 in 100 incidence. And so what we find really is this 1 in 2,000 is actually less than we would expect to see in these populations. We also had 1 case of a pulmonary embolism that does result from a deep venous thrombosis, most likely. And there was 1 case of rhabdomyolysis, which is severe muscle destruction and subsequent movement of the muscle contents into the circulation, and attempts to clear them by the kidneys. The point here is that in these over 32,000 sessions, we had less than the expected incidence of DVTs, and so then that raises the question of why would that be? And it turns out that that the way that the narrow elastic bands alter the circulation is that they periodically hold back the venous outflow, and then when there is muscle contraction, there's a rush of blood being ejected out of the veins, into the central circulation. And this kind of distension followed by evacuation of the venous channels actually speeds up and alters blood flow in a way such that if anything, it's flushing out the veins, not allowing these deep venous thromboses to start. And so, if anything, the elastic narrow cuffs are designed to actually reduce the incidence of DVTs. And these things can be used on airplanes, for example, where some people, if they're sitting for long periods of time and getting dehydrated on their way across the oceans, end up benefiting from doing these BFR sessions while in flight, and likely reduce the incidence of forming these clots during flight. And so one of the things is that this relatively low incidence of DVTs prompted the Japanese to do a couple of studies where they looked at the parameters of both clot formation and clot lysis in healthy subjects. And this paper right here is an example of it. And it shows that there is, if anything, a slight advantage to doing, in this case, Katsu, to improve the lysing ability for clot formation. So a little bit more on that. What we have in this next slide is a couple of videos of using a Doppler ultrasound probe and looking at the what pressures and things happen. And on the left-hand side, we have using a blood pressure cuff, and on the right-hand side, we have using a one of our BStrong cuffs. And here in the foreground, you see the sphygmomanometer that is putting pressure into the cuffs. So I'll start the blood pressure cuff one first and talk a little bit after it. And what you see over here on the Doppler is you're going to be seeing the arterial, there's the arterial flow in red pulsing, and then you'll soon see some blue signal which indicates the venous signal. And here it's kind of popping up, and
that shell at 0.
And this is at a pressure of 0 in the sphygmomanometer. A little out of focus, but the needle's down at the bottom here.
Go up to 150 on the.
And so now we're going up to 150 millimeters of mercury, which is likely higher than the person's, or is higher than the person's blood pressure. And what you see is that the red pulsing arterial signal disappears. So here we're at 150, and there's no signal on the cuff. Now we're going to end up releasing it, and showing that the arterial signal comes back. And also there's a little blue signal indicating venous return to the heart. So that shows that a wide, non-elastic cuff very quickly, just over systolic blood pressure, cuts off all blood flow in and out of the extremity, producing a risky situation. Here now with our BStrong cuff, and the transducer is oriented at 90 degrees to the other one, but otherwise you see a red signal indicating the artery and blue signals indicating venous flow, and you see both venous flow and arterial. Now we're taking this cuff up to 500 millimeters of mercury, and even so, we still see a arterial signal of blood being pumped into the extremity. And soon we'll see some of the venous return. Here's the blue signal coming on when there is muscle contraction involved. So the point of this is that even up to pressures as high as 500 millimeters of mercury, which is as high as our sphygmomanometers can go, you still have ample arterial inflow and venous outflow when muscle contraction takes place. This presents an extremely safe situation. Now, with respect to efficacy, here we have a article that was published in 2000 in the Journal of Applied Physiology, one of the most reputable physiology journals. And here this sums up really what the difference is, or what blood flow restriction training does. Each one of these four graphs has a velocity of contraction on the x-axis and elbow flexion torque or strength on the y-axis. And the open circle bar is before a certain kind of training, and the closed or the filled circles are in the thing after training. And what you see here is with high intensity weight training that you improve the amount of torque generated at all speeds of contraction with a program of heavy weightlifting. This is kind of the normal response that you'd like to see from standard weight training. Now, if you look at the same, well, one of the things to say is now down in the lower right, here we have an untrained control group that doesn't do any training but is tested twice, and you see that basically there's no improvement with in strength with doing no training, which is of course expected. And then above that you see the same sort of thing with no real change in strength associated with training with light weights, but without any BFR. And now in the lower left-hand corner, graph B, we see that by using the same low-intensity training that didn't produce any results, but when we add in blood flow restriction, we have the same kind of improvement in strength after a series of training sessions with the BFR and low weights as you get with the high intensity training, standard weight training. And if anything, it's kind of like there's even a little bit better of a improvement in strength when doing the BFR training. And so this is the primary finding of using narrow elastic cuffs, which is that you increase for very low levels of weightlifting, you improve strength and fitness quickly and similarly to that of standard heavy lifting regimes. And the advantage is that you don't have to be lifting the heavy weights, and you don't risk the injuries that may be associated with that form of training. And it also is something that is possible for all age groups and rehabilitation situations where the heavy standard lifting can only really be done by someone who's been well trained. Here is also some additional an additional graph from that same study, and here they have the BFR training showing approximately an 18% increase in muscle strength from the training situation, where the standard conventional training ended up having about a 22%. Both of these programs are significantly better than just doing the low intensity conventional training by itself without the blood flow restriction. Now, one of the things is those past two slides showed an improvement in strength from narrow elastic BFR training. And here we have a change in muscle cross-sectional area in the biceps, the brachialis, and the triceps from this same program. And this slide is a little complicated, but Again, we have the BFR low intensity training over here, the higher conventional training in the middle, and the low intensity training without blood flow restriction on the right-hand side. And what is apparent here is that you have robust increases in all these muscles from the BFR training and the standard training, but you don't get that from the low intensity training. Now, in addition to getting nice, robust increases in strength and muscle size from BFR training, it also happens quickly. And here's a graph from another KATSU study where they have really 2 weeks of doing daily sessions of either low intensity training or low intensity with KATSU training or BFR training. And here you see that there's a rapid increase in muscle and bone cross-sectional area within days of instituting the training, and that increases over the course of 2 weeks, where at the end of 2 weeks, there's a very robust improvement in muscle and bone cross-sectional area. Now, here is something that's interesting and usually comes up as a question. This is doing bench press activity, which involves both the triceps and the pectoralis. But the pectoralis does not have its blood flow restricted. Only the triceps does. And what you can see is that in the controlled light intensity exercise without blood flow restriction, there's not much of anything in the triceps or the pecs. But when you do the blood flow restricted training paradigm with the light loads, you actually get improvements in both the pectoralis and the triceps. Now, this is interesting. The pectoralis does not have its blood flow restricted, but it's still getting the same benefit in terms of the size of the muscle. And the explanation for this is that while both pectoralis and triceps are being used in doing the bench press, only the triceps is really getting into trouble. And the triceps is sending a signal to the brain that it's in trouble, and consequently ends up sending out a neural drive to all muscles that are involved in this exercise to increase their effort. And as a result, the pectoralis gets exercised as well as the triceps. And then because of this systemic response, the systemic hormonal response that I'll talk about in a little bit, both the pectoral, any muscles that are used in the exercise are going to enjoy the benefit of this anabolic hormone response. And so this is from the same study, and it's showing that with the 1 rep bench press max is improved with blood flow restriction training, where it's not changed significantly with just the light exercise without the blood flow restriction. And now we're looking at muscle thickness, again in this same study, and it's happening very quickly. These are days on the x-axis here, and it's happening in both the triceps and the pecs. This is the integrated EMG on this study, and what I want to bring your attention to is that this is integrated EMG on the triceps, and this is the control, and that you see that when you're doing these various repetitions, in this particular case, it was 30 reps for the first set and then 3 sets of 15 reps. What you see is there's a certain amount of EMG signal, which indicates the neural drive to those tissues. And that here, when you get, not so much in the first set, but in these subsequent sets where fatigue is setting in, the neural drive is larger. Their integrated EMG signal is larger than it is in the control situation. And that this also happens in the case of the pectoralis. So both muscles that are proximal and distal to the bands are getting their neural drive stimulated when used with blood flow restriction activity. And this also shows that the same thing happens. This is also part of the same study, but another paper. But this shows that when doing in one case, a controlled study with light weights only and no blood flow restriction, and then the other with the blood flow restriction training, that the leg press 1 rep max is improved with blood flow restriction training, thigh cross-sectional area is improved, and IGF-1 or insulin growth factor 1, which is an anabolic hormone made in the liver, is increased under those conditions, and that alkaline phosphatase, an enzyme that is a marker of bone turnover, is increased in the blood flow restriction training group. And this indicates that it's not just muscle that is getting the benefit of this blood flow restriction training. Bone is as well as blood vessels, muscle, and likely tendons, although the proof for the tendons improvement is lacking at this time, but it is likely that it also occurs. So here we go with what we think to be the mechanism. Belts are elastic, narrow belts are placed and pressurized properly to impede venous return and to change its character. And this distension and dilation of the capillary and venous beds leads to upregulation of angiogenic factors, which then leads to an improvement in the vascularity of the tissue. When you are impeding the venous return, the muscle is not getting the blood flow that it wants, and so there's a mismatch that is set up, and a disturbance of homeostasis ensues. And this has been documented by a decrease in pH or an increase in the amount of acid in cells, as well as a decrease in the PO2 or oxygen that is in the cells, as well as an increase in the lactate concentration in cells and in the area around the cells. This disturbance of homeostasis upregulates local protein metabolism in these cells, and this is primarily mediated by the mTOR pathway, which I'm not sure that we need to go into at this point, but we know that the mTOR pathway is also very responsive to low levels of oxygen and high levels of acid, as well as high concentrations of lactate. So from a number of different studies, this seems to be the local mechanisms to stimulate an increase in the size and strength of muscle. Now, in addition, this disturbance of homeostasis is being signaled to the brain, and the brain or the CNS releases an autonomic and hormonal and anabolic hormonal response, which goes everywhere in the tissues, and these hormones then end up binding to cell surface membranes, receptors on the membranes of the muscle cells, and facilitate and amplify the local protein synthesis that is already going on. In addition, because very little damage was actually done by the light, easy exercise, the tissues do not need to rebuild and quickly improve their structure and function. This slide it shows what happens to the central circulation doing, in this case, again, Katsu. Most of the studies that are in the literature have been done with Katsu, and it shows that at subsequently higher pressures, femoral artery flow, this is from bands placed on the legs, decreases, but never really completely goes away. And the same thing for inferior vena cava diameter, which is an indication of blood flow back to the heart. Again, it's decreased, but never completely goes away. And Also the size of the heart, left ventricular diameter, which is an indication of stroke volume, and blood in the circulation is slightly decreased, and as well as cardiac output, or the amount of blood flow that the heart is pumping out. These things indicate that blood flow restriction, narrow elastic blood flow restriction like KATSU and BStrong, impedes and reduces circulation and blood flow to the various extremities and frankly all tissues, but never really completely cuts it off. This is, these are data from a subsequent study where they looked at angiogenic gene expression as a result of BFR studies, or blood flow restriction studies. And what this is on the x-axis, or the y-axis rather, is mRNA expression, which is an indication of stimulating angiogenesis, or the proteins that are responsible for building new blood vessels. And here we have probably the most well-recognized one, VEGF, or vascular endothelial growth factor, and there's a very robust increase in the mRNA expression of VEGF to blood flow restriction training as opposed to normal control light training. And these other factors are also involved in building new blood vessels, and they are also upregulated as well. So this is proof that the vascular and endothelial system is stimulated by blood flow restriction training. This particular study is one, again, in Journal of Applied Physiology, but it talks about how motor units are created. One of the features of blood flow restriction training is that at first we are recruiting slow twitch fibers, or fatigue-resistant fibers, doing the easy exercise that we're doing. But these fibers are most dependent on having their blood supply intact. And so relatively quickly, these fibers get fatigued and are unable to continue with blood flow restriction training. And then what happens is, as these fibers drop out, we recruit faster and faster and faster fibers. And this is a way of recruiting all fibers in the muscle, such that very quickly we're able to recruit all the fibers in the muscle and have all of those fibers lose their homeostasis, and thus adapt to this new thing, improving strength and fitness. This slide is an example of how the oxygen in the active muscle is being reduced by blood flow restriction training compared to the same exercise without the blood flow restriction. And this is done with a technology called near-infrared spectroscopy, or NIRS. And what we see here is this, on the y-axis is the percent of saturation of hemoglobin in the muscle itself. And that's in this case, biceps, and it's the oxygen saturation of muscle, expressed as a percent from 0 to 100. And this particular subject is doing repeat bouts of 25 arm curls. And what you see here is that starting out at rest, the saturation of oxygen in the muscle is about 65%. And then with exercise, it goes down to the mid-30s. And then when they stop exercising, it goes back and forth. And actually, as the exercise continues, it doesn't get down as low, because now all the blood vessels are opened up trying to get blood into this muscle. And saturation during the rest periods is even higher than it was at rest. And then here is a fatiguing set of exercises that I'll show you. And then when the exercise is done, there's what's called a recovery hyperemia, and increase in higher than occurred at rest in that muscle. Now here's the same experiment with the same exercises, but done with, in this case, again, Katsu, and various different pressures in the bands. And what you see is that although it starts out more or less at the same place at rest, then with just applying the Katsu bands and doing some exercise, there's a very profound drop in the saturation of oxygen in the muscle, going down to the mid-20s as opposed to the mid-30s. And then with increasing the pressure and repeated exercise, it drops even further. And this process continues down to where you're getting to 10% saturation of oxygen in the muscles, or even less. And during these times when the muscle is down in here, the person or individual doing this is feeling a profound muscle burn, and at the end of this fatiguing exercise cannot continue, and then the cuffs are released and back up to normal. So one of the things to see here is that with blood flow restriction, we drop the oxygen to a lower point than is possible with even any kind of normal hard exercise, and that also that the higher the pressures go, the more profound that reduction in oxygen is. So here we have this cell going on, what the normal cell does and the normal mitochondria is it generates ATP by bringing in oxygen and various carbohydrate things like glucose or lactate or pyruvate, and these things are taken into the mitochondria and ATP are generated. And the byproducts of that are carbon dioxide and water. And in the case if the flux of carbohydrate moieties through the mitochondria is overwhelmed, some of that pyruvate gets transformed into lactate, and that is associated with acid, and the amount of acid is increased. When we're talking about blood flow restriction training, we're limiting the amount of oxygen that's coming into the muscle, and so more acid is produced, and the ATP is not being regenerated, and therefore the cell gets into metabolic trouble or a disturbance of homeostasis ensues. This is a slide that describes the mTOR signaling pathway. Suffice it to say that oxygen over here and a decrease in ATP over here are some of the stimulation to improving protein synthesis down here, and as well as having signaling from glucose and other surface receptors. These growth factors stimulate the upregulation of protein synthesis. And so this ends up being the kind of complicated mechanism that ends up accounting for the quick increase in muscle size and strength. This slide now, those previous slides dealt with the local mechanism that's operative. This disturbance of homeostasis is signaled up into the brain, and in the brain there is an autonomic response that increases heart rate, some increase in blood pressure, and an increase in breathing that occur from reflexly from this. But in addition, there is also a hormonal response that takes place in the thalamus and the hypothalamus, and then giving signals to pituitary to increase the delivery of growth hormone and other hormones into the systemic circulation. These graphs are from a study that show that. In this slide over here, we have whole blood lactate, and showing that in the exercise-only group without blood flow restriction training, you do get some increase in blood lactate from the exercise, but much more so in the case where blood flow restriction is added. And then also on the right-hand graphs, we have the increase in growth hormone that comes out of the brain, and in the gray line that you can barely see, when you're doing just control exercises, there's almost no increase or no stimulation or release of growth hormone. But when you're doing blood flow restriction exercise, 10 minutes after and more so 30 minutes after, there's a robust stimulation of growth hormone that is in the circulating blood. This is then a marker of the systemic response and is responsible for amplifying the local effects in tissue of increasing of strength and fitness. This is IGF-1, and it also shows that there's a higher but delayed response to repeated sessions of blood flow restriction training with BFR. And here we have VEGF. This is the angiogenic factor, and that similarly is increased with BFR to a greater extent than with standard training. Another compound that was measured from in that particular study is norepinephrine. Norepinephrine comes either from the brain or from the ends of nerve fibers that are associated with the autonomic nervous system. And clearly, there's a increase in norepinephrine associated with blood flow restriction training that you don't see with normal kinds of training. Again, showing an activation of the autonomic nervous system. And here is the same graph or the same time frame with growth hormone response, again showing the filled circles that the blood flow restriction training is increasing. So now, as I said early on, Dr. Sato had developed the beginnings of blood flow restriction training, or KATSU training, in 1966. It's been around for 50-some years. But recently, we've tried to extend his findings and make something that is more affordable, easier to use, and more comfortable. But with the same safe or small risk, very good safety record, as well as being able to be very effective. And this is an example of our BStrong system. Consists of 4 sizes of bands. A given individual would get 2 sets of arm bands of appropriate size and a pair of leg bands of appropriate size. But these are number 1, number 2, number 3, and number 4 size bands. And here is our hand pump that is all you need to inflate these bands to the appropriate pressure. In addition, there is an app that you can get on your iPhone or smartphone rather, and from that the pressures are prescribed, as well as looking at the various safety rules and tips for basic instruction. That's all well and good, and so we see how this can be used for various sorts of training. Another application is the use of therapy. And this is one of our Olympic Nordic combined athletes who was going off a jump in Europe on January 10th, 2014, and ended up having an untoward experience, and which resulted in a comminuted fracture of the top of his humeral head. You can see the various fracture fragments in this CT X-ray, and in addition, he tore his rotator cuff. He broke a rib, and this was essentially a season-ending injury. And he should have been, or would have normally been, operated on to repair this, but this would have resulted in him missing the Sochi Olympic Games, which were occurring a month from the time of his injury. And so we decided to use, in this case, KATSU. BStrong hadn't been developed yet. But what you see here is that this is the general approach that we use for injuries. You see his left arm with his broken humerus is in a sling, but he has a band on and he's doing hand grip exercise, but he's doing very vigorous exercise with the other normal side. And this ends up being exhaustive. And then in this next one, you see him doing ski jump imitation training with his legs and the leg bands on, while his shoulder stays immobilized, allowing it to heal. And in this slide, you see him doing roller skiing on a treadmill with his arm bandaged up in a sling, so it doesn't move, so the fracture has the greatest chance of healing, but we're able to mitigate the use of detraining and allow maximal exercise in a sport-specific way. And the short story is that we were able to get him back to being able to compete in his 6th and last Olympic Games. And this is the opening ceremonies on February 7th. Recall that he fell on January 9th of 2014. And here Todd is carrying the American flag at the opening ceremonies in both his right and left arm. And this is a very quick recovery. We followed him with x-rays, and this x-ray was taken on February 10th, still showing the fracture piece, but now starting to show little aspects of healing across that fracture line. And this is one of the ski jumps that he did. This is just a few days post the opening ceremonies, but literally just over a month from when he broke his arm and fell on that first thing. And as you can see, he's able to use his left arm, and this jump was a good competition jump. Now a week later, we're getting another X-ray rather, showing further healing. This kind of little dense white aspect is showing that the fracture line is healing. At this time, he's able to cross-country ski using his arms, and he's able to jump, and he has no pain in the shoulder. And then on February 20th, he was in the team competition, and this is the board showing the jump results, and Todd is right up there in second place on the jumps. And you can see here he's talking to reporters, holding his jump skis in his left arm. And then here he's out cross-country skiing using both arms. And so he was able to compete successfully and help his 3 other team members in the team competition to a successful relay competition. So that in basically 40 days with Todd, we were able to get him back to where he could compete the way that he normally would in an Olympic event. And that's just outstanding. Another couple of examples are Josh Saunders, who tore his ACL in a soccer game, MLS game with at Real Salt Lake. And here he is rehabbing in just 4 weeks after having his ACL repaired. And this is extremely fast, and you see that he has very little atrophy compared to his right side. And here he is a mere 5 months later playing as a keeper, and here he's planning on the left leg, which is the one that was repaired, and he's playing in an MLS game. Being able to do that 5 months after the repair is super fast. Normally it takes about a year for people to get back to their sport and soccer. Here is Ted Ligety, one of our Olympic gold medalists, and he tore his ACL actually last year. And here he is doing some of the rehabilitation exercises with the BStrong bands on. And this is on the operated leg. And you can see that this is very difficult exercise, but does not bother the healing ligament, and takes Ted to extreme fatigue and almost to where he can't do another rep. So here is another example where we use the BStrong bands for training purposes. This is a ski simulator. This is Michaela Schifrin. She's another one of our Sochi gold medalists in slalom. And and so what we're able to do here is we're able to get a very strong stimulus while doing very safe and sport-specific exercises. And she ended up using the BStrong training system for her preparation. And as it happened last winter, she had a fall where she damaged her knee, and she came back super fast in 5.5 weeks to go on and win the slalom Crystal Globe. She's currently leading the World Cup this year and is involving herself with BStrong system. So in summary, by impeding the venous blood flow out of an extremity and then asking muscle distal to the band to perform easy exercise, a profound disturbance of homeostasis is created in working muscle due to the mismatch between blood flow the muscle needs and blood flow the muscle can get. This disturbance of homeostasis upregulates protein synthesis locally and is communicated to the CNS, which in turn releases an autonomic and hormonal anabolic response that goes throughout the body and facilitates protein synthesis. Since little actual damage was done by the low absolute loads, improved strength and fitness occurs rapidly. Said another way, the body-brain was fooled into thinking fatiguing, damaging, maximal exercise was done, and it responds by putting out a robust rebuilding response. But since that damage wasn't done, the body gets fitter and stronger quickly. This is a new understanding of how the body adapts to exercise stress, allows all to rehabilitate and/or train more effectively with a quicker positive response. Thank you very much.